Joining me right now to discuss Dr. Stella Safo, an internal medicine physician in New York City. Dr. Safo, good to see you.
Thanks so much for having me.
So in your view, is this likely to be a real game changer?
I think it's absolutely going to be a game changer. You have to remember that COVID is a pretty smart virus, and it's going to do what viruses do, which is replicate, form new variants, and just try to survive. And so when we think about how we're going to manage COVID, we have to get as many tools in our arsenal as we can. And I think the J&J vaccine is going to be something else with its storage properties and with its efficacy levels that we're seeing that's going to definitely help us in the fight against COVID.
And when you say that the storage properties, meaning it can be refrigerated in a regular standard refrigerator, doesn't need the ultra cold freezers. And I wonder if that means it's going to be, I guess, more accessible, or it will open up greater opportunities for it to be in doctors' offices, for instance, to be administered to people?
Absolutely. I mean, the name of the game right now when we think about vaccinations is taking a look at what the barriers are and then systematically removing those barriers. One of the barriers is, for vaccinations has been the storage properties that we have to follow, the storage characteristics that the virus requires. And so you can imagine, if you need these very cold temperatures and you're asking a community doc to hold on to these vaccines, that's going to be a little bit harder than if you're using a J&J vaccine that's more of a classic vaccine that can be refrigerated. Doctors, pediatricians especially, are very used to storing most vaccines and would be able to give this out really easily. So it just increases that access tremendously.
One of the researchers who helped identify the new coronavirus variant discovered in New York City says the strain is spreading at an alarming pace and could result in a drop in a vaccine efficacy. How concerned are you about that?
So these new strains are kind of tough because what we're finding is we're going to see the strains, or we're going to see the variants before we really have a sense of what they mean in terms of public health, transmission, and severity of illness. So right now we know that there's a new strain in New York. We don't know exactly what it means. The good news, and I really take a lot of comfort in this, is that all of the major vaccine manufacturers and developers are already anticipating that there will be not just the New York strain, the California strain, and all these other strains that we've seen, but probably many more. And they're already back in the lab tinkering with the vaccines to figure out would a third shot be helpful for Moderna and Pfizer, or would a booster shot be helpful for J&J? And so I think that as much as we are all worried, it should make us worry to actually do the public health measures we've been talking about. Wear your mask, socially distance, while we allow the scientists, virologists, and others to really make our vaccines even more robust to be able to protect us. But right now, I'm not scared of the vaccinations that we're getting won't keep you at least somewhat protected from even the new variants.
All right, we always love that optimism. We all need it. Dr. Stella Safo, thank you so much.
Thank you.